a pinched nerve. So what is a pinched nerve? So if you have ever suffered from any tingling, numbness, burning, or a achy sensation down your arms or legs because of a compressed or irritated nerve in your spine, it could be your neck, your mid back, or your lower back. If you've ever suffered from any of these, then it is possible that you have pinched nerves in your neck or your back. Now, what these are some of the symptoms, and why it happens is it could be a various number of causes, ranging from rheumatoid arthritis to stenosis in the spine, or disc herniation, or slip disc as it's commonly known, or even issues like pregnancy. Now, pinched nerves are not just in the spine. They can also happen, say, at the level of the wrist, which is your carpal tunnel syndrome, which is commonly seen in pregnant women. And it could happen at the level of the elbow when you have an ulnar nerve entrapment, and then you get tingling down into your forearm and your little and ring finger, also known as cubital tunnel syndrome. However, I'm not going to go into the details of these causes. If you want to know more about them, I've done quite a few videos on my YouTube channel, and if you go to YouTube and type my name, Swati Prakash, and nerve or wrist pain, or whichever topic you're looking for, you can get the details from there. And if you like what you see, you can always like and subscribe. So today we're going to talk about how can you manage when you have a pinched nerve. Now, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. So basically, I help moms of younger kids who work in high-stress executive jobs manage the aches and pains that came with their motherhood journey. Now, what that means is it's simply any aches and pains from ranging from your neck pain to back pain to heel pain, or probably just a poor posture from carrying your baby from that pregnancy weight, or it could be a weak pelvic floor leading to incontinence, etc. Now, when you have these issues, they can hold you back from putting 100% into your job, from being a good mom. Now, usually moms are very busy people. Well, most of us are very busy people, but especially working moms. So this is the aches and pains usually get brushed under the carpet because we got so many other things to do. This is where I come in and help you with simple strategies, exercises, tips, etc., to help you manage these aches and discomforts so that you can be a better you can be a better mom, you can have less mommy guilt, and you can be a better professional at work. Now, going back to our topic for today, how can you manage a pinched nerve? Now, the very first thing is to know why you have this pinched nerve, and most probably if you've had it for a while, you must have gone to the doctor and they may have given you a diagnosis. However, what is it that you can do at home is, firstly, in our lives we tend to be very static. Movement is very important. Now, this statement has been used over and over again, but I will just give you the context of why it's important with your nerves, is because oops, sorry, my alarm just went off. So the reason why this is important in context of your pinched nerves is that when you are sitting static for a long period of time, the pressure and the stresses build up on your spine. And when these build up, you basically are going to have more pain in your spine, and thus whatever is irritating your nerves, for example, your disc issues, your stenosis, etc., will actually get aggravated, and then your nerve pain will get aggravated. It is said that if you are sitting static for more than 20 minutes, and especially if you have a pre-existing disc condition in your spine, so a slip disc or a disc herniation, it tends to aggravate the condition. So it doesn't mean that you should sit for that 20 minutes and then that's your break time. But hey, if you are one of those who sit for hours in the meetings, then why not? You can take a break every 20 to 30 minutes, okay? If you can't take a break, what you can do is, say you're in a meeting or a formal dinner setup or somewhere where you can't move, what you can do is you can uncross your legs, shift your weight from one side to another. If you're in a place where there's nowhere to sit and you're standing, just put your weight from one foot to the other. Keep shifting your weight, lean against a wall or a chair if you can. So basically, you don't have to do big movements like going for a run or a walk. You can just shuffle around in the place where you are, whether sitting or standing. That is the whole concept behind an adjustable standing desk, right? So it's a new fad nowadays. So even if you have one of those standing desks, make sure that you adjust it and then sit down as well after say 20 to 30 minutes, if not an hour. Okay, so that is about movement. The second thing is, if you need to, then support the area where your nerve is getting pinched. What I mean is, if you say have a carpal tunnel syndrome, you probably want to use a wrist support. For example, if you're a mom and you notice that every time you're feeding your baby or holding your toddler, you cannot keep your wrist in a neutral position. So what that means is your wrist is not deviated to the left or the right, or it's not or it is not bent like forwards or backwards. So it is in the middle and in the midline with your forearm here. But when you're holding your little kid, you just cannot keep it in neutral. So what you do is take a wrist support, one of those wristbands that the tennis players use, or you could do a makeshift one at home. Take a piece of cloth and then wrap it around your wrist. What that does is it'll keep your wrist in a neutral position, and the moment you bend your wrist, that support here, the wrist splint, or the sorry, not splint, the wrist support will give you an indication saying, hey, my wrist is bending, I need to straighten it. So you always have that feedback going into your brain. So it is very important to maintain your joints in a neutral position, and you could use a cervical collar, a lumbar belt, a wrist support, or other, say if it's your knee, you can use a knee brace as well. So yes, your knee can affect your posture because it's the way you're standing, right? So if your knees are not supporting you well, it will affect the way your lower back is sitting or is situated. So it will affect your posture. The other thing you can do is your posture itself. Now, when you are sitting, most of when most of us are sitting, we realize that after a while we've slumped down in our chairs, and then we correct ourselves again and again. We slump down. So this cycle keeps going on and on and on. So you want to make sure that you maintain a good posture. Now, if you're looking for details of how to achieve and then maintain a good posture, I have done a free training on this in my free community. If you're watching me on on LinkedIn, Facebook, or any other platform, I will leave a link to my free community in the description of this video. If you're watching me on Instagram, the link is in my bio. When you click on the link in my bio, it'll take you to another page. As you scroll down, you'll see my community. You can join from there. So this is the community where I discuss topics related to spine and joints, so basically your neck, back, and joints of the body, and the conditions affecting, and such tips and strategies which are simple and easy and effective as well. So yeah, I hope that was useful for you. And if you have any questions for me, you can drop them into the comments below this video. You can message me, whatever works for you. And if you have any topics that you want me to cover, please do let me know. I'll be happy to help you out. Alrighty, I'll see you guys next time.